Welcome back. There's new research that further shows the importance of being proactive when it comes to your heart health, especially if you are at risk. And here to break it down for us is Baptist Health Cardiologist Dr. Scott Davis. Good morning.
Morning, how are you?
I'm doing great. How are you doing?
Doing good. So we've talked about calcium scores before. Now what's that? That's that new screening tool that we have, which is looking at calcium development on the outside of the heart artery, right? Your heart, same size as your fist, 3 arteries supply gas to the motor. So the calcium score is looking for rust on the outside of the pipe. And so it's a wonderful screening tool. We have the Be Heart Healthy campaign through Baptist that provides this screening tool. The next question though is, all right, what do we do with the information, and is it, can we do something to kind of ward off or prevent any development of heart disease? A new study's come out of Australia that was published in JAMA recently that looked at folks with intermediate risk of heart disease. In other words, their calcium score was in that intermediate range, and they divided into 2 groups. A group that was really aggressive with their cholesterol, got on cholesterol medicine, got coaching, got encouragement to pursue an active diet and exercise program, and then those who just got some coaching but no cholesterol medicine. And they looked at them for over 3 years, and they went back and did an angiogram on all these patients, and they showed significant plaque reduction in the patients that had aggressive cholesterol lowering therapy with being on a statin, being on one of the cholesterol medicines. And so it's a new finding that's showing favorable outcome with, all right, look, if I identify early upstream my risk, can I do something about it? It's one thing to find out that you're at risk. It's a whole other thing to say, all right, what are some tools that I can do to then kind of redirect the ship? And so this is a really an important study, because finding a screening tool in cardiology has been a bit of a challenge versus, say, a mammogram for breast cancer or pap smear for cervical cancer. This is now a new tool that we're really encouraging insurance companies to now identify and pay for. We offer it for less than $100 through Baptist, but it's still an out-of-pocket screening cost. Now that we've identified the fact that with being aggressive with it and lowering plaque burden, the next step is going to be, okay, how's it going to affect outcomes, lowering heart attack risk, lowering, bypass and stent risk, et cetera. So very encouraging data.
Yeah, and I mean, this is so important for our Kansans, as 100%. Our rates are so high when it comes to anything heart-related. I tell people, we're in the buckle of the belt of heart disease living in the South. And so some of it's genetic, like we've talked about. Some of it's just lifestyle and the Southern fried diet. But anything that we can do to kind of redirect and improve our risk. So we're encouraging folks to reach out. We have this Be Heart Healthy campaign that through the 1-800-BAPTIST or 1-888-BAPTIST number to call, and then we can get you plugged in for a screening of a calcium score. Okay, and under $100. That's great.
Yeah.
All right. Well, we learned so much. Thank you so much for joining us. Now, of course, if you want to get in touch with Baptist, you can go to their website, or you can call the number that's right there on your screen.